hope you all found that really helpful, and thanks everybody for sharing, because it's not easy to kind of step up and put yourself out there. Thanks a million, Professor Fionnuala. That was amazing. So now I'd like to introduce to you the fantastic Dr. Patricia Byrne. Dr. Byrne has been with us every step of the way since we set up Thrombosis Ireland. No, you've been a fantastic support. She also is the author of our information leaflet on the website on recovering psychologically after a blood clot. Patricia currently holds the post of Principal Specialist Clinical Psychologist in Psychology and Medicine Service in St James's Hospital. Within the post, she has a special remit to the patients of the National Coagulation Centre. In addition to her professional training, she is a practitioner in mentalisation-based therapy, MBT, and holds practitioner status as a neuropsychologist. Her main areas of interest are the psychological processes inherent in living with a long-term health condition, the promotion of patient-led self-management process, how attachment experiences influence health behaviours, and the promotion of hospital-based psychology services nationally. With that, thanks a million, Patricia.
Thanks, Anne-Marie. Thank you to Thrombosis Ireland for asking me to talk today. And thank you for inviting me today. And I'm really glad I arrived a bit early, because for me it was really a real privilege to hear what we call the stories, patient stories, being shared by all of you. So thank you for that. Because really, when it comes to any health condition, of course, as we all know, there's the medical aspects of it, but it's so much more than that for each of us, and in terms of your story. So what we're going to talk about, and I think we've got about 20 minutes, isn't that right? But I must say, Fionnuala really did a great job in terms of facilitating people sharing their story. And if we have, I think there's coffee after this, Anne-Marie, is there? So, but I'll try and speak to this, but leave time at the end then if people do have observations or comments they want to make. Just to say before as well, I just caught Fionnuala when she was going out the door there. The fact that there's a national programme being developed at the moment, I'm very excited about, because I'm hoping as part of that national programme there will be some psychology recruitment into that programme, because at the moment I'm in a post, but it's primarily bleeding disorders, although I really feel it's important, and as Anne-Marie said, I've done some work with Thrombosis Ireland. I really feel what Fionnuala mentioned around the psychological aspects, and that's why we're going to talk more about this now, is really important, and hopefully through the national programme we'll be able to get more psychological resources that will be specialised for people who've had some form of blood clot. So maybe if we just begin. So I've worked in, I'm a hospital-based psychologist, and when I started, which is over 30 years ago, there was very few psychologists working in hospitals in Ireland. I actually was at the National Rehabilitation Hospital for nearly 20 years. I moved to James's 11 years ago, and it's really only been in the last 10 years that we've had psychological services really developing in general hospitals. And there's, you know, for a long time this aspect of health conditions being very much focused on the physical and the medical. There wasn't the acknowledgement and the thinking about how does illness disrupt people's life stories. And some of you have given, all of you today, have given wonderful examples of, but difficult examples of how being unwell with a significant health condition can have all sorts of repercussions in your life, not just from a medical point of view. So it goes beyond this. So I just thought I'd put up a few slides about what we consider to be normal psychology, as in we all have needs. And this is Maslow, goes way back, I think to the 1950s, about our hierarchy of needs. And you can see down the very bottom there, there's the idea of we all need to have our physiological needs taken care of first. That's a bottom line. And as any of you who've experienced, you know, acute care in a hospital know, that is where it all needs to start with. And then we go up through the needs. And for some of us, depending on where we're living in the world at the moment, safety is a big issue. For some of us, thankfully, here as we are in Ireland, that's not as much of an issue, but certainly I was listening to something about Ukraine this morning on the radio, and for people there, that safety issue is very much obviously part and parcel of their needs at the moment. So it's that idea of, as we move up through the pyramid, we can address more of these needs, and hopefully most of us will all our needs in these different aspects of the pyramid will be being met in some way or another. But as I said, it's not true for all of us all the time, and sometimes it goes right back to the physical, what's happening, and that's the bottom line. What we do know is that in terms of normal development and for us to thrive as human beings, there's 4 fundamental processes, the 4 S's, and this is a psychiatrist called Dan Siegel, really interesting man, who has really kind of married neuroscience with psychological well-being. And these are givens, really, and this goes right back to the babe in the cradle. But it's something that we all need throughout the different stages of our lives. We need to be seen, to be recognised, to be understood. We fundamentally need to feel safe, and that's both within our environment, but also that sense of ourselves and where we're at in terms of our own bodies. To be soothed, to be comforted when times are difficult, and to feel that security, a sense of predictability in the world. Not always possible, but it's about seeking it out. But it's interesting to note that we've been amazing as a species in surviving, and we are very, very adaptive as a species. And one of the reasons we're still around as a species is the fact that we are very primed to look for threat in the environment. And the reason that cavemen kind of didn't become extinct was that their brains developed in a way that they were constantly looking for threat in the environment. And in doing so, in scanning for that threat in the environment, it meant that the species, as a human species, kept thriving, kept developing. We still have that innate instinct in all of us. And that can be very, very protective at times for us, but also sometimes from a psychological perspective, it can be something that we need to acknowledge and look at and actually try and tame to some degree. And it's particularly very true for people who've had any sort of acute, sudden illness event and who may be living with a health condition, because it can feel sometimes that perhaps we're more primed to look for the difficult things that might be happening. So being unwell provokes this threat system and this stress system in our bodies. And we know that through lots of studies. We also know that in hospital admissions, that patients also, leaving aside their medical condition, their arousal systems are more vigilant because they're in this stressful environment. So if we come back to this idea of illness and what is it about? Obviously, we can have, flus, colds, kind of all sorts of relatively innocuous symptoms in our body that we manage well. But depending on the significance, the severity, the impact of the symptoms on our lives, does it stop us working? Does it stop us taking care of our kids? Does it stop us, going to the rugby club on a Saturday night? Controllability also. Do we feel that it's been well managed, that I know what's happening, I understand? And what Fionnuala was asking there was a really important question around understanding of what has happened when somebody's had a blood clot, because the meaning and understanding that we have about our condition is really important in terms of helping us manage that psychologically for ourselves. What does it represent? Does it represent something that I feel is out of control, or does it represent something, no, I know what the risks are, I know how I need to manage it, and I have a team that will help me do that. And also the course of the disease. That last question that was asked about, long-term management, will I be on treatment long-term? Is this a long-term health condition? And if so, what is the meaning of that for me? So depending on the illness, it has all sorts of representations for us in terms of in our mind about the meaning. And the meaning that we attach to our illness also has an impact in terms of how we manage and cope psychologically with that illness event. So one of the things, I was talking to a colleague yesterday who works in cancer in James's, and there's a huge emphasis now with cancer patients on living with uncertainty. And it's something that I see is so true for a lot of people who've had a blood clot, that they don't feel they're necessarily on completely solid ground again, that there might be that sense of perhaps things can shift or change. And a lot of our work actually in the hospital is about the idea of how do we tolerate uncertainty. Because the reality is, for all of us, whether we've had any sort of health condition or not, I think we're all becoming more aware the world is an uncertain place and things change, and sometimes change very rapidly. But human beings don't like uncertainty. It's another thing, survival part of us. We like things to be predictable because that keeps us safe. But actually, uncertainty is part and parcel of all our lives. But it's a particular challenge, I think, when you have a health condition. The other challenge, and again, Fionnuala talked about it, is this idea, and again, we see it with a lot of different health conditions, is the idea of recurrence. And again, how do I manage that fear, which is a very normal fear. Again, it's this idea of trying to find a way of keeping myself as safe as possible. But again, it's something that I think it's a theme that's shared across people with long-term health conditions, whatever it may be. A lot of people have this worry about recurrence. But there is good news. And certainly in my role in the hospital, it's part of the work I do. This is a Japanese term, kintsugi, which it's an art that they use. They never throw out lovely pottery. What they do is they mend it with often precious metals, and they actually go out of their way to emphasize the cracks and the actual reparation and that has been done. And in some ways, for me, it is this idea of healing, that, after a sudden illness event, a frightening illness event, people say to me, I just want to go back to normal. But actually, that's kind of a bit of a trap, because we can't go back. And that idea that once you've gone through an illness experience, such as a blood clot, and the aftermath of it, it does change you. And this idea that actually, how am I going to integrate this somehow, this experience of illness, into my life and allow myself to actually still thrive and find meaning. And it's an ongoing challenge, I think, for many people with a long-term health condition, but I do see it every day with the patients I work with. Sometimes people have setbacks, but nevertheless, this idea that we can thrive and we can move forward in our lives is something that is very possible. So I just wanted to say a little bit. Anne-Marie mentioned, I didn't know if I recognised that person in the bio, but anyway, I work as part of my work is in coagulation, particularly in bleeding disorders, but some in coagulation disorders as well. But I sit in a department that's called Psychological Medicine in St. James's, and we're a bunch of psychiatrists, nurses, and psychologists. And our job is to work with people with some sort of physical health condition in St. James's, but who have a psychological aftermath or struggle as a result of their physical health condition. And the good news is that a lot of the time, so if we start at the top, a lot of the time when people have an illness event, there's always distress, because what we talked about there about the idea of change, instability, threat, it's inevitable that there will be distress. But in general, what we find is that, again, this idea of huge adaptability, in general, people are very able to recover, particularly just with the support often of patients and families. And I would also say patient support groups like Thrombosis Ireland are essential to people, that sense of community. Somebody mentioned about the phone call, I think this lady did, that you got with Anne-Marie, that you had with Anne-Marie. So just the sense of being part of a tribe can be really, really helpful in terms of recovery after an illness. Sometimes, though, people have more mild distress, and again, that's where nursing teams and coagulation teams and consultants and nurses can be so helpful in terms of helping with that distress. Then you might find that sometimes people have more moderate distress, and psychoeducation, so what Fionnuala was talking about there, even simple things as simple as the card, simple as, you know, coming here today and hearing information, but also sharing your stories. That again can be really, really helpful in terms of managing distress. It's only if things become more severe, and it sometimes does happen after an illness event, people can find themselves really struggling. And what I would say to people is if they do feel that their mood is very different as a result of their blood clot, it is very worthwhile talking to your GP you know, through primary care, there's some very good services, but equally through Thrombosis Ireland, you can be directed. But that's relatively rare. Our colleagues in psychiatry, there's a lot more psychologists and nurses working in psychological medicine than there is psychiatrists. And there's a reason for that, is that in general, people do recover well psychologically from health conditions with time, but also with support. So this idea of positive psychology and the idea of really positive, you know, this only came out in the 1970s, 1980s, rather than pathologizing people's response to difficult times in their lives. There was this movement around what's called positive psychology. So a real emphasis on positive emotions, on relationships, on meaning making, and on well-being. And the HSE now have this whole health and well-being section in the HSE, and they're doing a lot of good work in terms of, again, educating people around good, you know, how people can manage their own mental health. What do we need to do in terms of, as we move even into old age? I mean, there's huge research now in St. James's going on to aging successfully. So these are all just pillars, I suppose we could call them, of how we can thrive. And if we don't have to have all of these pillars in our lives, but these are the ones that studies have shown have the best evidence in terms of thriving and growing throughout our lifespan. And that doesn't stop even in old age. As I said, we in James's, we have the Mercer's Institute for Successful Aging, and people into their 70s and 80s, 90s are coming in and doing all sorts of interesting things, and we know that that's a really important part of aging. But I suppose probably for me, the idea of relationships and engagement are really important at any stage, and particularly after recovery from an illness event. And some people were mentioning there being unsure about things like getting back out and exercising, or, you know, whatever maybe they were doing beforehand. And, you know, yes, we need guidance on that, but we do know that interacting with other people has a huge benefit to us in terms of even from they've discovered these what's called mirror neurons in our brains that we actually really need to fire off each other. It's a really important, that sense of feeling connected to others and social engagement is a really important part of recovery from any illness event. It's also important to remember that how we see the world matters when something difficult has happened to us. And how we see the world, the lens that we see the world through comes out of all sorts of different, it comes out of our attachment experience, our background, but also how we've gone through adversity in the past, All of that matters in terms of a sudden illness event. The good news is that we also, and this comes back to our capacity to adapt, even if we feel like we're stuck, we can, through sometimes taking a step back, through actually thinking about a situation in a different way, it doesn't necessarily change it. It doesn't undo the fact that sometimes things have been very difficult, but it does, that idea of changing the colour of the lens can be really important. And you can, that can be done through, engagement with others, trial and error, also getting more information, sharing information. All of those things matter. So the good news again is that we do know that with significant moral, traumatic challenges, whatever they may be, including illness experiences, we can develop, we can experience what's called post-traumatic growth, or positive personal change. And I don't know, maybe nobody feels like that today in the room, I'm not sure. Maybe some people have got to that. This isn't about minimising what's happened to people and the trauma they may have experienced and the difficulty or the fear they may have experienced that they may still have as part of their experience. It's not an either or, but what we do know is that with time, and if we can move out beyond, because sometimes we can get very stuck in our illness experience in that sense of threat. And it's the idea of moving, what can I do to move beyond that and see the world, as less threatening, nevertheless knowing that this experience has been life-changing for me and often has been traumatic too. So what can help? So I'm a clinical psychologist, and people expect, when they meet me, I'm going to sit, and I do most of the time, sit and have a conversation with them. And a lot of the therapeutic work we do is talking therapy. And there's different ways of doing that. It can be all sorts of approaches that we use. But what we also know, and it's becoming more and more talked about within the world of psychology and psychotherapy, is that for whatever reason, but particularly if there's been a traumatic event for a person sitting with you who's come to see you, that it has to start with the body. So if people feel, so our autonomic nervous systems, and I don't know if people have, the idea of, we have our sympathetic part of our autonomic nervous system and we have our parasympathetic. People might have heard the term fight-flight response. So that's if we get frightened or we feel cornered, we can often, the adrenaline, all the stress hormones in our body, our heart rate goes up. We can get very either angry or we want to run away. So that's our sympathetic nervous system. That's part of our autonomic nervous system. There's also another part that we will collapse. The way people fainting? Yeah. Sorry, Anne-Marie, are you okay? Yeah. Yeah. And the idea of fainting with shock, that's again our autonomic nervous system. And what we do know is that unless people feel regulated and quite calm in their body, they're not able to use their prefrontal cortex. This part of the brain is what people use to problem solve, to think about themselves, to try and figure things out, to feel, okay, they're strong emotions, but also feel I can overcome this or I can figure this out for myself. So what we know now is that unless our autonomic nervous systems are relatively calm and regulated, that we can't actually do that talking therapy work. So now a lot of the time, there's all sorts of somatic-based therapies now that people do, and there's things like therapeutic yoga, there's kind of things like all sorts of, a lot of them being Buddhist-type mindfulness-based practice, all sorts of interesting body-based therapies that will calm the body down and be the place to often begin with people in terms of trying to figure out more about what is going on. And breath work is also very important. So that idea of having a good breath pattern, not having shallow breathing, practicing what we call belly breathing, diaphragmatic breathing, all of that is really helpful, because what it does, it's our body saying, okay, it's starting down here, it's starting in the heart, it's starting with the breath, And if we send that message to the brain, that has a wonderful impact, because it's calming the brain down. It's saying, the body here, I'm okay, I'm safe, I'm feeling okay, and therefore that really helps in terms of our mental health. So we're beginning to look at that even in James's around what we can do around that, but it's a really important place to begin. And it doesn't have to be necessarily things like mindfulness-based treatments or yoga. Somebody mentioned they liked to fix old cars. I don't know if you're still doing it. Who was the gentleman that was fixing old cars? Not now.
I still open the bonnet occasionally.
Okay, and have a look, yeah. But the idea of any sort of activity that brings us into what we call flow, kind of it's like a focus, that the only thing that matters is what I'm doing right now. And that could be embroidery, it could be knitting, it could be fixing cars, it could be going for a walk and just focusing in on nature as it is. All of these things are really important in terms of minding our minds. So what we said about safety is so important. And as I said, we can't think clearly. We can't use the prefrontal cortex unless we feel safe. And again, coming back to the breath, that is really often a good place to start. And I'm kind of conscious that for those of you who've had PEs, sometimes it can feel quite triggering to kind of focus in on breath. But at the same time, normal breathing is a really helpful physical tool to regulate ourselves down. But if it feels too triggering, you do things like, we'll talk about now, 5 senses. But the idea is awareness, is recognizing what's happening in terms of stress in your body, and pausing and checking with yourself, noticing the physical cues, noticing the emotional cues. Do you feel that knot in your stomach? Do you feel a heart rate? And again, Fionnuala mentioned post-traumatic stress. There is certainly some studies being done around people who've had blood clots, that certainly it is the aftermath can certainly be put into that context of post-traumatic stress response, certainly. And sometimes people come to see me because they have become overly vigilant about their bodies after a blood clot, and they've developed what we call health-related anxiety, which is very, very normal, because you're checking all the time, because you've been told you make sure everything's okay. So it's about trying to find the balance between managing the aftermath of a blood clot, but at the same time, not, every little symptom is suddenly, oh my gosh, what is that? But it's a fine line, and certainly I would suggest to people in the aftermath of an acute recovery from blood clots, it's a very normal thing, and it's over time around kind of allowing yourself to go, okay, I'm just going to maybe wait a little bit longer and then I'll go, or I'll talk to the GP tomorrow rather than today. But it's certainly a real challenge, I think, if people have had such an illness experience. So some of the things, and we talk like cognitive behavioural therapy a lot in the work we do, and the idea that our bodies, what's going on in our bodies and our mind-body connection, it's all related. How we're thinking about ourselves, the impact that has on our feelings, and also then on what we do in terms of behaviour. But some of the things that just might, in terms of if we feel that our stress levels, and again, it's a very individual thing, but if these are changing, the amber light aspects of things, some people have terrible problems with sleep and it's just a given for them. But if you're noticing that things are changing for you in this way, it might be worthwhile in these different aspects. It might be worthwhile having a conversation with your GP, talking it out a bit more with a friend, just thinking a little bit more about what your stress signature actually is, what it's like. Because we all, by the way, stress is really important. That's what challenges us. It keeps life interesting. But it's when we feel overwhelmed, when we feel that we don't have the resources to cope, that's when we can get into trouble with it. So it's just about knowing what your own stress signature is, and kind of figuring that out. And then if things feel like they're getting more unbalanced, then maybe that's the time to do something about it. The other thing as well is that a lot of the time, and people, sometimes cognitive behavioural therapy, people talk about, you know, thinking positively. All you have to do is think positively and it'll all be fine. And actually that's, I never use the term thinking positively. I can't stand the term. It's about thinking what's a helpful thought and what's an unhelpful thought. And again, coming back, if you've had an illness experience, you will be sometimes catastrophizing, being more anxious, oh my God, what's happening here? So it is really important to challenge ourselves about our helpful and unhelpful thoughts. But it's also important to remember, people kind of spend a lot of the time trying to avoid or dampen down difficult or uncomfortable emotions like sadness or even anger or even shame, or feeling just overwhelmed. And it's like, I don't want to feel that, so I'll just push that away. But actually, it's really important to practice feeling that emotion, feeling that feeling, and wondering about it. And there's a lovely poem, I don't have it with me. Some of you might know, I think he's an Iranian poet called Rumi, R-U-M-I. And he's a lovely, he's, gosh, I can't. Anyway, I think it's about 1,000 years since he was around. But anyway, he's a lovely poem called The Guest House. And it's about that idea of just welcoming all emotions. And I think, particularly in the Western world, and this quick fix and this idea that everything has to be perfect, we can push away difficult emotions. I don't want to feel that. But actually, in terms of good mental health and resilience, it's really important to actually say, what is this about? And be curious in yourself if you find yourself with an uncomfortable feeling. Why am I feeling that today? What's that about? So I just thought I'd say a little bit more about fear of recurrence, because I know that this is a big one, and it's a big one for lots of people with health conditions. We see it a huge amount in our cancer patients, but it's very relevant, obviously, for people who've had blood clots. And it's this idea that actually certainty is very much part of our lives. I don't think this is, it's there, but when it comes down here, it doesn't work. So this, you can see uncertainty there, and it's a given in our lives. And the more we can learn to tolerate uncertainty, the more resilient we can become. And it's inevitable that we'll spend time over here in the fear-based part of uncertainty. And what can feed that is highlighting the fact that things can be ambiguous, things aren't always certain, we don't always know the answer to things, and kind of getting stuck on that, and also on the idea of catastrophizing. Again, we all do it at times. It's an inevitable thinking style that we all have at times, but it's about recognizing that we're doing it and saying, hold on a minute now, can I do this differently? Can I think about this thought in a different way, in a more helpful way? So, but again, when you've been through a difficult illness experience, catastrophizing can really be kind of it comes to mind much quicker, and it's kind of nearly go-to emotion often, or the go-to thought that you'll have. This is not going to work out. So it's about challenging that, stepping back from it. We also can find a restricting possibility. And again, obviously with medical advice, with good advice from physiotherapists, from nurses, getting information. Because what can happen when people have gone through a very sudden, very difficult illness experience, it's nearly like you become, sorry, I know I've moved away from the mic. You become, I'll just do nothing. I'll just sit here, and if I sit here, I'm safe. But actually what that does then is it feeds that fear. Whereas if we move over to the other side, the hope side of uncertainty, and what that's about is exploring possibilities. It's about challenging ourselves. It's about tolerating the fact that we don't always have all the knowledge. And it's about optimizing the situation we find ourselves in. And I just thought today that I don't know for people, and maybe we'll get a few minutes at the end, but I do think probably fear of recurrence is probably one of the biggest challenges psychologically, I think, for people in the aftermath of blood clots. So how do we move? This is all well and good, but the idea of what's nourishing me and what's depleting me. What in my life is really feeding me in every way, not just physical. What do I enjoy? What would I like to get back to? Who are the people? And I think as I get older, I'm becoming more intolerant of people that I think, no, that's not good energy. I don't need, they're just depleting me. And, you know, what is going to nourish us? And whatever that might be, wherever you find that, whether it's through relationships, family, whether it's through activities, hobbies, whether it's through something solitude like reading a good book or listening to music, whatever it is, looking and checking in, is this nourishing me in some way? Focusing our energies again. You know, energy and energy economics is really important after a blood clot. Fatigue, I know, is a huge part of recovery and can stay a challenge for people. But again, through fatigue management, harnessing our energies, choosing, setting clear goals, again, it's really important, and it's a key one in terms of general mental health as well. So life is in the small details. The idea of what is important now. That's really a fundamental one. Life is in the small details, and not the. Sometimes people get caught up in the big things they want to get back to. That big round the world trip I want to do, or maybe, you know, just a weekend in the west of Ireland is a better place to start. You know, or just small details are so important. How much time? I'm running out of time. Yeah. So values versus rules. The idea of what's important to me. What's my bottom line? It's not about rules, because we all have rules for ourselves, but what direction do I want to go in? And this idea of values-based living in terms of domains of your life. And we never get it all right in all domains of our life all at the one time, but it's about thinking about what we want to do in those domains and how we want to live our lives, and are we living to our values in those times. So I'll just invest in. I was conscious when Fionnuala was talking about this idea of action, putting things into action, putting our values into action. And I said, this is not an appropriate photograph. It's too big a goal. I actually think if I should have had somebody up there walking by a canal with the trees in the background. So I'm going to change that, by the way.
That's how you feel.
Yes. Yes. Yeah. And not for good reasons. Conscious of our inner critic. We all have that inner critic, moving from a harsh inner critic, a lot of Irish people have it, to a more compassionate inner critic. Using mistakes as learning opportunities, learning from it. Thank you for listening.
I just have a question that just came in from Margaret, and she was saying that her brother had an embolism after having COVID, and that he ended up with quite severe depression afterwards. Now look, he's back, he's walking and he's getting active and he's trying to get himself back to normal. He's feeling a little better, but he did have a real drop in his energies and in his mental health, basically.
Yeah.
Would that be like a thing you would see normally? Yeah,
well, the idea that, I mean, if our bodies aren't working properly, that has a knock-on effect in terms of our activities and in terms of our sense of increased vulnerability. So it does have an impact on our mental health. It sounds like he's going in the right direction. I will always say to people, if they're concerned, if they think that depression is not lifting, or that it's stopping the recovery, certainly a chat with a good GP is an absolute wonderful asset to have. Start there, because there is a lot more, and it's one of the good things that has come out from COVID, is that there's been a much more emphasis on mental health, and people are much more inclined to talk about our mental health across, everybody, around what's helpful. But it could be, if he feels he's getting stuck at all, that could be the place to start, is with his GP.
Thank you very much. Anybody else got any questions? No?
Okay.
Yeah.
No, it's just the whole sort of thing. When I was in hospital, no sooner was I treated that I was absolutely reassured of recovery. And that was fantastic. When I come out of hospital, 3 weeks after I come out of hospital, you tell people that you've had clots, the expressions, and then you begin to think of your mortality. Yeah. And that's what's put me down.
Okay.
And it's taken a while for that to be back positive again.
Yeah.
That's the,
I think that's a very good point, because on one hand, connecting with others, relationships are so important in terms of recovery. But sometimes, and I think because, blood clots are invisible, like you haven't got a plaster of Paris on your leg, or you haven't got, some obvious wound. So often the invisibility is there, and everybody has an opinion. And sometimes, you're right, people can be unhelpful in what they say. They maybe don't mean to be. Maybe they're catastrophizing. And so I will always say to people, try and discern for yourself. Was that a helpful conversation I had with that person in the supermarket today? Or maybe I should just park that and go over here, because I know this person has been helpful before. So that discerning, I think is really important, because, there's a lot of people who think they're, amateur doctors and amateur medical experts. So I think it's your own gut instinct about what's working for you, but also checking in with yourself. And am I going in the right direction? Am I reclaiming what I want to reclaim? Sometimes after an illness event, there are things we want to get rid of in our lives. Yeah, I don't need to do that anymore. My priorities have changed. And that's okay too. But allowing ourselves to discern that, and not, just thinking about it and wondering, including the difficult emotions, like fear, like sense of mortality, that can be really, really important to take time to consider that. Okay.
Thank you. Wonderful.